If you need to transport a patient over a long distance, there's more options than you might think, but not all of them are right for every situation. In this video, I'll break down your options. What types of long-distance medical transports are there? The first type of medical transport that we'll talk about is air transport, and this can include air ambulance. So air ambulance is typically a fixed-wing aircraft or a rotor-wing aircraft that is actually capable of being a flying ICU that has all the medical and necessary equipment that will be needed to save anyone's lives up in the air, whether it be a couple hundred feet or up to 40,000 plus feet. Air transport could also include helicopters and not just airplanes. Oftentimes we'll see a helicopter or rotor aircraft utilized with shorter distances in the same state or off the island or hard to reach areas where there's not a landing strip available for a safe patient pickup. Another type of air transport option would be a commercial medical escort, and that's a situation in which a medical transport professional will be on board a commercial airliner with a patient as a person there for additional assistance that may be needed to get a patient from point A to point B. The next type of transport that is available would be considered ground transport. This can include non-emergency medical transport, which could be needed or utilized when we have stable patients. Also have long distance ambulance or critical care services on the ground as well. Typically, we'll see here the critical care transport teams that can execute these long ground transports or interfacility transports. They have a team on board that has all the ICU capabilities and the ability to transfer patients that are on cardiac trips, pressors, on mechanical ventilation, or specialty care that may be needed, such as ECMO, balloon pumps, and Impella devices, just to name a few of the critical care capabilities those ground units may have. Another form of ground transfer would be a private medical car. So this type of service is not a very commonly utilized service, as a private vehicle doesn't typically have the equipment necessary or available to the team or the patient on board the vehicle. We could generally categorize these types of transports almost as if they were a medical escort on the ground. So in these private vehicles, it would be a medical escort such as a paramedic, a registered nurse, or a physician that is in the vehicle with the patient with limited amount of medical equipment, but the knowledge and understanding of when they may need to go to a higher level of care or pull over, get an ambulance, or go to a hospital. How do you choose the right medical transport option? First, you're going to want to assess the patient's condition, and then we're going to have to put into consideration the urgency and the nature of the illness or injury and how far of a distance the patient will have to travel. It's also very important to understand the cost of what this transport is going to be, how we're going to pay for this, or if your insurance will be able to provide support and pay for this transport. So in this decision-making process, typically when you call in to an air ambulance company and talk with their operational specialists or case resource managers that begin the cases, they're the ones who are able to give generalized information regarding the differences or what is available. But in addition to that support system, we have a medical coordinator on staff 24/7, 365, and that's a registered flight nurse or a registered flight paramedic that is working hand in hand with the operations center, and they're able to determine what the patient does need medically and what is the safest way to transport this patient from point A to point B. How do we ensure safety and comfort during transport? Here at REVA, our number one pillar is safety. So that is the prime focus of every single transport and everything that we do in all levels of our organization. But ensuring safety and comfort on board the aircraft is making sure that, one, we're staffing each and every medevac flight with the appropriate critical care team on board to ensure that we can meet all the needs that may be necessary with the patient that we are taking care of. Inside these aircrafts, I said earlier that they are a flying ICU, so we are able to ensure that we have everything that could possibly be needed in the event of an emergency situation. We also have the necessary tools, equipment, and medications to also keep a patient that is injured or critically ill quite comfortable on these trips as well. In addition to the tools and equipment that we carry, we have a 400-page protocol manual of transport protocols, and then an additional medical administration protocol manual for our staff that they function out of on a day-to-day basis in real time. In addition to that, we have some alternative stretcher pads and mattress pads that we're able to utilize for our patients, especially in these long-haul missions, because we understand that these stretcher systems are not necessarily designed for ultimate comfort, more so for safety and the ability to work in a medical environment. So we have things such as waffle mattresses that are a nice puffy air mattress for the patient to lie on throughout the duration of the trip. It also allows the patient to be turned onto different sides so that we can prevent things such as bed sores and ulcers in the future. What are the legal and ethical considerations for a long distance transport? Some of the major considerations is one, that the patient are actually fit to fly and cleared by a medical doctor there, as well as medical direction within our department in medical, and that we have a receiving bed facility and where we're going to take this patient to and they're accepted. That is very important before we even initiate the mission. Next, we have to make sure that we put into consideration any needs to get in and out of a country. So if we're bringing someone, for instance, back to the United States of America, we need to make sure that if it's a US citizen, that they do have a valid US passport. Or if it's not a citizen, do they have appropriate visas? Do we have appropriate ESTA paperwork? And what we do here is we have an entire checklist, or a virtual checklist, in our operations center, led by our director of operations, that ensures that we meet all these requirements before even taking off. In addition to that, do we have an airport that is willing to stay open long enough? Or are we going to get here in time, in a timely manner, so that we can ensure the airport is open? Or if it's not, have we discussed with the appropriate authority that they will keep it open for the air ambulance, as they will typically do that based on what country you're flying in and out of?